So Charlotte Maxeke Academic Hospital has been closed since April, and there's still no telling when this will change. The institution was shut down after a fire caused a section of the parking garage to collapse. Patients who've been needing life-saving treatment have been forced to find medical attention elsewhere. The Chris Hani Baragwanath Hospital, for one, is currently under severe pressure as it had to accommodate patients from Charlotte Maxeke Hospital. Wits University's Health Sciences faculty has added its voice to growing calls for the reopening of Charlotte Maxeke as medical students at the university use that hospital for their clinical work. But what else is at stake? Let's unpack this for you. Professor Daynia Ballot is head of clinical medicine at Wits University, and the prof joins us now via our video link. It's lovely to have you on the program. Thanks for making time. In your view, have we been able to actually quantify the health cost of having an institution like Charlotte Maxeke closed for this long?
So no, I don't think so. I mean, if you consider that Charlotte has almost 1,000 beds, and is a major health facility, not only in the province, but in the country and the region. We simply cannot withstand the loss of those beds for such a long time. I mean, there are certain treatments that are only given at Charlotte in a particular area, such as hemodialysis and cardiothoracic surgery. Those patients have had to find places elsewhere in an already overburdened health system. So our health system runs to full capacity at most times. So to have 1,000 patients pushed into other hospitals has really got very significant consequences. Patients are lying on stretchers in casualty waiting for beds for days. Patients are lying in stretchers in the wards. I'm told that the trauma admissions at Chris Hani Baragwanath have increased as much as 50%, and they're seeing a lot more severe injuries. And these are patients who would normally have been managed at Charlotte. Cancer treatment is interrupted. There are significant surgical backlogs, and we've now entered our third COVID wave. So we are now having literally almost 4,000 patients in Gauteng alone hospitalized for COVID. And we just can't cope. We really need that hospital open.
And I'll tell you why I asked that question first. I mean, at the time of the fire, a lot had rightly been said about how no lives have been lost because of the actual flames. But we actually don't know how many lives potentially could have been lost because of the consequences of that fire itself.
I agree with you entirely. I think the hospital and staff must be commended for evacuating almost 800 patients with no casualties, with no loss of life and no casualties. But the ongoing closure of the hospital does place lives at threat.
Yeah. We speak often about the health crisis of having a hospital closed, but because of this particular institution's role in our society, there are also impacts for the academic progress of some people at Wits University.
So we have almost 1,000 clinical students, so not only at Charlotte, but I mean across our clinical training platform. And we've had to move patients who were at Charlotte, students who were at Charlotte, to the other hospitals. So the groups of clinical students that are being taught are very large. And this impacts negatively on things like bedside teaching. It's very hard to have 20 plus students all around one bed. And that's what Wits has always been good at. We've always been good at clinical exposure and clinical training. So we are concerned that that's going to have a negative impact on our students. And just remember that our students have already gone through a year of decreased clinical exposure due to COVID. So we are very concerned. Charlotte is a major teaching resource, a major academic hospital. And although it's not in my school, the School of Oral Health Sciences has had to suspend academic training because all their students are trained at Charlotte, and there isn't another place at the moment to put them. So their academic training has been interrupted for the whole time that Charlotte has been closed.
Of course, the last thing you need is to push for this hospital to be reopened, only for casualties to result in that, because the hospital simply wasn't ready for that reopening. What, if any, reason have you been given around why the institution to this day is still largely closed?
So it's a bit of a complicated answer, and that is that the hospital is not only managed by the Department of Health. We all think that, the hospital is run by the Department of Health or the CEO. But that's not entirely true. The departments, so there are 3 government departments involved in the clearances for opening the hospital. So the Department of Health is one, but then you've got the Department of Infrastructure and Development who look after the bricks and mortar, if you want to put it that way. And then you've got another government department that looks after the occupational health and safety. And it seems that there are delays among the different government departments. And there are certain parts of the hospital that will not be able to be reopened soon, which are the blocks that were affected by the fire. So blocks 3 and 4, if you know the hospital, will probably not, are structurally damaged and will have to, probably be rebuilt or whatever. So they can't be reopened. But blocks 1, 2, and 5, which is the majority of the hospital, are structurally sound, and we are just waiting for these clearances to be produced so that we can open the hospital again. And that's why we have supported Premier Makura's call to make this a local disaster, because we believe that will facilitate the reopening.
Yeah.
That this will just stop all the processes so that we can reopen the hospital.
That's exactly where I was hoping to go, actually. Those calls are receiving support in some respects, but what would that actually mean? Say tomorrow there is a declaration of a local state of disaster. How does that essentially lead to the reopening of this institution?
My understanding is that it would free up resources, so it would free up financial resources, hopefully, but it would also mean that people can be appointed to do the job without having to go through, for example, tender processes, which all take long. So the process should be speeded up by being able to appoint people to get the job done so that we can then open the hospital. There is a plan already in place to open the hospital in a phased approach, starting with radiation oncology, which should be open soon, and then block 1, block 2, etc. And it's really hinging on this, on the occupational health and safety issues.
Right. I wonder what lessons nonetheless are being learned, Prof, as we, I guess, go through what closing an institution like Charlotte Maxeke actually means for health in Gauteng. In some respects, it's a sobering lesson to ensure that all other institutions surrounding one like Charlotte Maxeke are at the standard that Charlotte Maxeke is, isn't it? I think that's just one of the lessons I can think of.
Absolutely. I agree entirely.
Yeah. There are also people who are suggesting that this is not just a health crisis, but very quickly becoming a humanitarian crisis. Is that an exaggeration, or do they have a point?
I don't believe it's an exaggeration. I think that there are patients who are really suffering, and it's difficult to quantify unless you go and do the counting, and how do we? So if you have not been able to go to the clinic, the health system has tried very hard to accommodate, but the point is that 1,000 beds is a significant number of patients. And Charlotte provides a really significant and big service to our population. And it's really difficult for surrounding institutions that are functioning at capacity to take on the extra burden.
Yeah.
And so, it's quite possible that people have not been able to get their treatment. Surgical procedures have not been able to be done, and who knows what's happening out there. So I do believe that it is a disaster.
You're in the academy, in the academic space. Help us understand, I guess, ways through which institutions like Wits University that rely so much on Charlotte Maxeke are trying to make up for the shortfall, especially once we consider those clinical students that you just referred to earlier on.
So Charlotte is one of the big academic hospitals affiliated to Wits. The other big one is Chris Hani Baragwanath Academic Hospital. Then we've got Helen Joseph Hospital, Rahima Musa Mother and Child Hospital, and Nelson Mandela Hospital is also linked to Wits. So what we've had to do is we've had to reallocate those students in the School of Clinical Medicine to those different hospitals. But one must also understand is that the doctors who work in those hospitals are the people that teach. And these are the doctors that are also dealing with the additional burden of the added patients from Charlotte, from COVID, already working under, strain. And they are saying that they are overburdened and demoralized and really not coping. And for example, Helen Joseph Hospital and Rahima Musa have had a terrible water crisis. And, then we're sending additional patients to them. So it's really, we desperately need Charlotte open again.
Right. And the impact on research, Prof, how is that impacting your colleagues' ability to go ahead with the much-needed research, I imagine, because Charlotte Maxeke is simply not open?
Well, research trials that are being conducted at Charlotte have been interrupted. I mean, as far as possible, researchers have tried to reallocate, tried to relocate their patients to the different hospitals. But, for example, we have a research, Wits Clinical Research Unit is in Block 4. So it has been completely non-functional, and we'll have to make some other plans. So the impact is not only on service delivery, it's also on training and research, as you say.
Absolutely. Well, yeah, please go ahead.
No, I say all of that. All of those are reasons why we really need Charlotte open.
Point made. I mean, in the absence of any kind of cogent explanation around why this hospital needs to remain closed, given the cost of it not opening, it becomes difficult to understand whether or not anybody's considering these other impacts that the closure is actually having. Let me thank you for your time nonetheless, Professor.